I believe everybody's in from the waiting room, so please start.
So, hello, and thank you so much for joining us. There's a lot of people here because what we're going to talk about today is just so meaningful. I'm Cathryn Hoy, and I am a registered nurse as well as the provincial president and interim CEO for the Ontario Nurses Association. We represent 68,000 nurses and healthcare professionals and 18,000 nursing students working across all sectors of healthcare. And it's important to remember all sectors of healthcare because it is touching every single sector. We're here today to call again for this government to take immediate steps to keep the registered nurses, registered practical nurses, healthcare professionals, porters, PSWs, cleaners, and all the other staff in our hospitals from leaving, and to bring back hospital staff, the right number, from nurses to dietary staff who have left their jobs, and bring on board new vital frontline healthcare for hospitals to continue to operate. It's so desperately needed. We have heard from Premier Ford that he claims that Ontarians have access to the care they needed. I'm here to tell you that's simply untrue. We're here today to call again for this government to take immediate steps like yesterday, to keep the nurses we have, bring back the nurses who have left their jobs, and bring on board new nurses. This starts with repealing Bill 124. In my opinion, it's the root cause. Restoring our collective bargaining so that nurses and healthcare professionals can be compensated fairly and be shown the respect that they have more than earned. Let's be very clear. Nurses and healthcare professionals have shown incredible courage and dedication throughout this pandemic. Many Canadians nurses, believe it or not, made out their wills before going to work as the pandemic began. Now, can you honestly believe that? Think about that. Really think deep and hard about that. They did that because they feared they would die, but they went in anyways. That did not stop them. So it takes a lot for a nurse to not show up to care for those that need them, for our people of Ontario. Thanks to the pandemic that is far from over. In a seventh wave, 8, 9, when's it going to end? And thanks to the government that has refused to work with those who provide care and have solutions. Nurses, healthcare professionals have passed their breaking point. They're burnt out. They've been made to believe that there's no hope of improvement. And that's why they've left. They've walked just because there's no hope. Right now, ERs are closing and ICUs and other units are cutting beds. I call it the silent closures because our communities have no idea what is really happening within those walls. Nurses have been asked to work back-to-back shifts, sometimes for 24 hours straight. Some sleep at the hospital in case they're needed. Others are called back in with as little as 5 hours between shifts. Some frontline healthcare workers haven't had a vacation in 2 years. Can you imagine? No time just to sit, re-energize, and sleep. This situation didn't happen overnight, to be clear. It is a result of years of underinvestment and understaffing. Since we are the heaviest hit on the provincial budget, we're the easiest target. So this is an opportunity for our government to step up and do what's right for Ontarians. We are urging the government to listen to our united voices and look at us all here as healthcare unions representing 120,000 frontline healthcare workers, professionals, and nurses. It takes all of us together, and you need to take meaningful action now to ensure a stronger public healthcare system for every Ontarian. Thank you.
Michael, you're on mute. Sorry about that. Hi, Michael Hurley, President of CUPE's Ontario Council of Hospital Unions. The Premier was in Stratford this week. It's a small city surrounded by communities whose hospitals are struggling with a staffing crisis, and many of which have closed their ERs temporarily. Wingham, Seaforth, Listowel, Clinton, and St. Mary's. And yet the Premier was reassuring us that almost everyone will continue to receive the care that they need in a timely way. We know that rural and northern hospitals in Ontario, in communities as far apart as Alexandria, Perth, Hearst, Kenora, and Red Lake, are struggling to keep services open and their ERs functioning. We know that big city hospitals like the University Health Network, William Osler Health Center, Sick Kids, Lake Ridge, Hamilton Health Sciences, Kingston Health Sciences, and the Ottawa Hospital are struggling or have closed ICU units or ERs. Our internal polling suggests that the hospital workforce is exhausted and demoralized, and that without some significant changes, the exodus of hospital staff will accelerate. We must face the fact that this situation will get worse, not better, without a vigorous plan to deal with the crisis in the short term and in the long term. Ontario has the fewest hospital staff to population of any province in Canada, and we're also at the bottom of the Organization of Economic Cooperation and Development in this respect. Successive Ontario governments have underfunded hospitals against their real costs and closed 25,000 acute care beds over the last 30 years. We went into the pandemic with inadequate capacity, and our hospital system is struggling now as staff leave and cannot be replaced. The Financial Accountability Office projects, based on the recent Ontario budget, that the Ford government will significantly underfund our hospitals against their real costs for the next 5 years. And in an industry where 85% of spending is on staff, this means the hospital staff vacancy rate will grow and not shrink. Workloads will increase. The pace of staff leaving will increase too. This is the first commitment we need the Ford government to make, that they will fund hospitals at their real costs going forward. The hospital vacancy rate for nurses is over 20%. We have over 20,000 unfilled hospital positions in Ontario. By the official numbers, we think those numbers are much, much higher. Set against that number, the licensing by the regulatory colleges of fewer than 4,000 international health professionals, many of whom are destined for primary or long-term care, can be seen in contacts. It's just one of several tools available, but it's not going to solve our problem by itself. We have a workforce that is exhausted, demoralized, and looking at the door after toiling through the pandemic, suffering real wage cuts, and working in an environment that is often unsafe for them. Frankly, we need to make working in hospital better paid and safer. And we need to staff up our hospitals to deal with the workloads, which are impossible and which threaten the quality of patient care. With more hospitals potentially closing units, ICUs, and emergency departments, the government still has no real comprehensive plan to staff up our hospitals, and this is completely unacceptable. We propose these solutions. First of all, we have to support the existing workforce to ensure that they continue to work. And that means staffing up to reduce workloads. It means providing mental health supports. It means investing in making hospitals safer for staff and for patients, offering full-time employment. Half the work in hospitals is part-time, and investing in such on-site support as childcare. We can't ignore the fact that wages have been set at a level which means that the staff in hospitals will have a real wage cut this year of 8%, and Bill 124, which prevents them from collective bargaining, needs to be repealed to deal with that. That should be an urgent issue for the government. We need to put in place financial incentives to discourage retirements and enhance hiring and retention, and to encourage people to pick up extra work. There are over 10,000 nurses and other regulated professionals who are licensed and not practicing in Ontario. We should attract them back to work with incentives. And we need a plan from the government to significantly, and we mean significantly, increase the number of post-secondary spaces for all types of health professionals, from personal support workers to registered nurses to doctors. Turning this staffing crisis around is possible, and the well-being of many Ontarians depends on our working together to solve it. We're expecting the government to act. Thank you. And now I'd like to introduce Sharleen Stewart, the president of SEIU.
Thank you very much, Michael. Good morning. As Michael said, my name is Sharleen Stewart. I am president of SEIU Healthcare. Our union represents over 60,000 healthcare workers in Ontario. I can't overstate that this press conference this morning is very significant because 120,000 hospital workers in our unions are coming together to cry out for a life raft. So what we are doing this morning on their behalf is putting forward 5 actionable solutions to keep hospitals open and stabilize the crisis in Ontario's healthcare system. Ontario can either have a plan that works or it can have failure. And what we have today in Ontario is a failing healthcare system. It's simply a matter of priorities and a willingness to take immediate action. Unfortunately, Premier Ford has a plan for strong mayors and a weak healthcare workers. The real life consequences of Premier Ford's reluctance to invest in the people on the front line of care is continued hospital closures and health service disruptions for the people of Ontario. Health spending per person in Ontario, as Michael said, is the lowest in Canada and 10% below the average of the other provinces. And Premier Ford acknowledged just this week that 1 in 10 people in the province are not getting the quality care they need or not receiving care at all. You simply can't run a car on empty, and you can't run a hospital on burnt out staff. That's why we're calling for immediate action on the 5-point plan. Again, 1, provide the existing workforce with physical and mental health support services. 2, send a signal that the provincial government is listening to the cries on the front line by repealing Bill 124. Premier, that's a stroke of a pen. You can do that this morning. 3, put in place financial incentives to retain staff. 4, recruit back retired staff. And 5, to invest in training now for a growing and aging population. I say this sincerely. If Premier Ford doesn't like our plan, then what's his? Premier Ford likes to say that Ontario is open for business, but how long will that be true when our healthcare system is closed? Just a few hours ago, Statistics Canada reported a loss of healthcare jobs. The number of people working in healthcare and social assistance declined by 22,000 positions last month. And as reported, the bulk of those losses were in Ontario and Quebec. We know that's because the unaddressed stresses in our hospitals have turned good healthcare jobs into dangerous healthcare jobs. We recently surveyed data from SEIU hospital workers, and what I want again to share, the findings that we saw, was that everyone really understands how poor working conditions underpin the exodus of healthcare staff. 73% of hospital nurses sometimes or rarely feel safe. And 1 in 4 hospital nurses and other staff never feel safe at work. The number of registered practical nurses that indicated never being exhausted was 0. That's not a typo or rounding down. The percent of nurses never feeling exhausted is 0, and that is repeated in every classification in the hospital. Nearly 60% of healthcare workers say they are burnt out all the time and in need of mental health supports as a result of their job. This is what happens when you treat hospital staff as a commodity instead of as people, and it's dangerous for the patients of Ontario. I'll close the same way I started. Ontario can either have a plan that works or it can have failure. And what we have today in Ontario is a failing healthcare system. Thank you for joining us this morning. And if you have any questions, please raise your hand or put your questions in the comments. I'll pass it back to you, Michael, to monitor.
Thank you very much, Sharleen. And we'll go to Richard Southern, please.
Hi, Richard Southern City News here. The government contends that this is an issue that is not unique to Ontario. And that's true, isn't it? This is happening everywhere, is it not, the situation in hospitals?
Thank you for the question. And yes, the Premier repeatedly says that. But as I said, and I don't know if it's something that he likes to stand out about, but he is the poorest performing province in the country. Yes, there is a province, but he is the one that has the least positive outcomes in healthcare. He spends the least per person in the province. Recently, as Michael said, the report was that during the pandemic and the federal money that was received by the province, our province spent that money on reducing the debt. So yes, it is a province, countrywide problem, but Ontario has the award of having the worst conditions and the worst focus into the spending of the budget and finding real-time solutions.
I'd just like to add to that also. I was just at the Premier's conference with all the premiers across Canada. And there are premiers out there that are looking to make improvements to healthcare because they realize that is the only way that they're going to save healthcare and retain their staffing. So that's what we're asking for them to, for Ontario, for the Ford government to step up the plate and I guess lead by example. When we are the largest province with the largest number of healthcare providers, why don't you lead by example for the other provinces? And I just want to reiterate what Sharleen said. Ontario underspent $1.817 billion in healthcare dollars, despite having $22.7 billion more in revenue. So I'm a little lost at why we have a problem here.
And I would just add, comparing ourselves to the other provinces is actually to Ontario's disadvantage because we are an outlier. We're at the very bottom in terms of beds to population and staff to population. We've underfunded and cut for years. And now, as we experience a pandemic, the lack of capacity becomes stark. So it's true that we're a province among other provinces, but with respect to this being a problem that's shared, it's much, much worse in the province of Ontario because we went into the pandemic with so few staff to patients relative to the other jurisdictions. Holly Mackenzie-Sutter, please.
Hi, thanks for having us taking our questions today. I just was looking at your list of the 5-point plan, and you have number 3, like put in place financial incentives to discourage retirements. Like, what do you guys think would be an appropriate financial incentive in terms of kind of amount with the raise? Like, I'm just looking for kind of more specifics about what you think would be appropriate to actually make a difference here.
I would like to comment on that. I go back, and many of you have heard me say this, at one point nursing surpassed the police, and the police are our partners and we respect them and we need them. And but police made less than nurses, and they were brought up to parity with nursing. So, and they have surpassed us by, I believe it's around 14%. So why is a female dominated profession paid 14% less than a male dominated profession when they felt at one time they needed to bring parity between male and female? So wouldn't that be great incentive to make all of us equal, since we all provide safety for our communities 24/7, 365 a year?
And I would just like to add, Holly, too, it's not just a quick one-off answer, because that's what we're really stressing here with the Premier, that he sit down with us and let's have a plan to really evaluate every profession in the hospital. There's some immediate wage adjustments that need to be made on certain classifications to keep them working. You can't just, cover it with one paintbrush covers all. There are a need to really sit down and have a well thought out plan that can be implemented immediately on some and maybe have phased in on others. But it isn't just a one shoe fits all. We would like to meet with them and have those questions and conversations with him immediately. One of the things is the agency staff. It's been reported that they pay 2 to 3 times the salary for agency staff. That money could be used to definitely implement more full-time jobs as well, which is what the frontline is asking for and is desperately needed. So it's a conversation we would really welcome having with the Premier.
And I would just add, like, we're not, we didn't come with a number. We came with a sort of a number of proposed solutions, which we think taken together could really be helpful, in terms of how much of an incentive. That's obviously something people would have to sit down and talk about, but, including, with the people who would be affected in terms of what might incent them not to retire, for example. But the fact is that we have many people in a position to retire, and we can't really afford them to leave. So we have to have, I think, this discussion. I apologize to Richard Southern. You had a follow-up question, and I moved on too quickly. Back to you, Richard.
No worries at all. Just real quick, if you could weigh in on the move made by the health minister last night, asking the College of Physicians and Surgeons and Nurses about a faster accreditation of those trained out of country.
I could speak on the College of Nurses. I just read it quickly, but I noticed there was a piece for the college to scale up the international trained nurses. That wouldn't be under the College of Nurses. That's why I'm asking for the repeal of Bill 124, so that we can bring back the retired nurses, that they can go in and support and mentor them in their new workplaces to help upskill them to know how Ontario healthcare systems work. So that would be the solution to upskilling.
I would just say, Richard, when you look at the number that have been licensed so far, and you look at the official number of vacancies, the official number is something like 20,000 in the hospitals. We think it's probably double that. The 4,000 or so that have been credentialed so far this year is one small step, but of course, all those people aren't destined to work in the hospitals. Some of them are for primary care. Some of them will go to work in long-term care of the community. So, I mean, the government is seized on the one thing that appears that they're doing, which is, trying to get the colleges to credential people faster. But this is a problem which requires a multifaceted range of solutions, and it's in this. It's in addressing the other areas that they've been woefully short, we think. Ross Lord, please.
Sorry, could I get my follow-up as well? Because I got one question.
Apology.
Okay. Yeah,
Go
no,
ahead.
that's okay. No, I just was wondering because you mentioned kind of stuff about wanting to have these meetings and get to all these points that you've outlined today. But I was just speaking with Ontario Health and Executive yesterday about how they're kind of expecting, hopefully, kind of the staffing strain might slow down in the next couple weeks as the COVID wave recedes, but then it's likely that it's going to potentially rise again, like in the fall, if we have another wave of COVID and kind of these problems aren't going away. So I guess I'm just wondering to get from you guys, like the timeline. If I understand that like you want to be having these meetings and making sure that people involved are getting a say in kind of the solution or what kind of incentives we're talking about here. But I'm just wondering like what kind of timeline you think is appropriate and kind of necessary to avoid this situation happening again in the fall or kind of on repeat into the future.
For us, the timeline for the meetings could have been yesterday. We could make it this afternoon. That's how critical it is, and I'm not exaggerating. And we focus a lot on COVID and the wave, but it's bigger than that. When I talk about the silent closures, it's labor and delivery, it's surgeries, it's renal, it's cancer care. It's a lot that the communities don't know about it. So we need to talk about it now, Holly, and there is not a quick fix. That's why I'm saying that Bill 124 is the root of the problem. We need to try and tap into resources we have in this province, which is our retired nurses or nurses that have left to travel elsewhere to bring them home. And we haven't even talked about agency nursing in this. There needs to be something done with that because it's going to bankrupt our system. When we're paying 4 times or more the hourly rate for an RN than what we need to, that money could be reinvested back into the people that are at the front line now. So I know the focus is on COVID, but honestly, it's far, far bigger than that. We have one hospital that's working with 85% approximately agency nurses. So that is like 4 times their annual labor budget.
Sharleen, did you want to speak to this?
Oh, I agree, Catherine. we're ready. We've been, again, ringing the alarm bells for years. Just last spring, if you will all recall, we ran commercials ringing the alarm bells about the conditions in hospitals every weekend. This is, the second, third media conference that we've had. We see more emergency closures. So it really was, a year ago that we should have had this conversation. We could see this coming, and unfortunately, we haven't had the time with the Premier. He hasn't stepped up and done the immediate solutions that we pointed out today could be enacted this afternoon.
And I'm concerned that the government may think that this is simply a problem caused by vacations, and that once the vacation season is over, this problem will go away. But the problem is that we have a workforce that is exhausted and demoralized with impossible workloads, and they're taking cuts to their real salaries at the same time, and all of these things together are encouraging people to leave. And I think all of our unions' internal polling shows, the prospect of increased numbers of people leaving, and that will happen as we go into future waves of this pandemic. So why the government has not summoned people earlier to some sort of discussion about this, I don't know, but you would think that this would be the government's top priority. Ross Lord, please.
Okay, thank you, Michael, Cathryn and Sharleen. Can I just, before I ask my questions, can I find out where each of you is, your location?
I'm in Kingston today.
Okay, thank you.
I'm in Alberta today.
Oh, okay. Do you mind telling me where in Alberta?
St. Albert.
Okay, thank you. And Michael?
I'm in Ottawa.
Thank you. So we're hoping to include in our coverage tonight some of the incentives that Newfoundland announced the other day. I don't know if each of you has gone through those, and I also don't know how far they're going to go to keep or, entice nurses to come back to the workforce. The retention bonuses, signing bonuses for casual RNs, increases in overtime for vacation period. They're offering to reimburse licensing fees for retired RNs, $500 to obviously try to make that more likely to happen, that they'll come back from retirement. They're talking about a locum premium for remote areas, 24/7 mental health supports, childcare options, bursaries for students. I don't want you to speak to something that you may not be familiar with, but I can't help but wonder how many of those, if any, might make a real difference if they were applied in Ontario.
So I could speak on a few of those, and I just wanted to add to the vacation piece that we don't have very many nurses on vacation, so it's not a vacation issue. And even before the pandemic started, we were already short about 150 nurses per 100,000 population. But this retention bonus, let's be clear, it wasn't a bonus. It was retention funds. And those nurses work for every single penny of that money. And it is not a percentage increase, because a percentage increase lasts forever on your wage.
So how much difference, if any, would these Newfoundland measures make if they were applied in Ontario? Some of them might already be in effect for all I know.
Well, I believe the Newfoundland is maybe $3,000. And the Ford government gave $5,000 in retention monies, of which some nurses have never seen a penny. And let's be clear, $5,000 was the top end. A lot of nurses got half that, quarter that, $500. So please don't think that every nurse in Ontario received $5,000, because they did not. So I could speak about the retention piece. And then as far as the education monies, we have in Ontario more applications per seat nursing than we can fill. I have a friend with a son with a 97 average that did not get into nursing. So that's a problem. I truly believe that those monies need to be invested into the front line right now that are working every single day. They're the ones that need those funds.
If I can just add, Ross, like some of those things might be very attractive in Ontario. I have not read them yet, but I want to go back to Bill 124. That's what unions do. They negotiate a lot of those benefits for their workers, and Bill 124, which I'm sure that province doesn't have, really does restrain us. It handcuffs us from even being able to negotiate some of those things for the workers. Right now, mental health and PTSD is a real thing. Members call me and literally break down crying on the phone, saying, I can't take it anymore. Their families are putting a lot of pressure on them, saying, you are literally going to kill yourself if you continue to work yourself to death like this. They could start with that, supplying mental health services to the staff. And again, removing Bill 124, that is absolutely ridiculous. I can't believe we're still talking about this in this time with the staff shortage, the economy, the mental health support. So some of it may work, but that's what we're saying. Let the Premier meet with us and repeal Bill 124, let us bargain improvements, and let's have a conversation with the Premier, an Ontario solution, as he likes to say.
Yeah, I can't help but wonder as well if the battle lines are drawn to the point where I don't know if ideology is part of the problem, but you set out your letter a couple of weeks ago and you got scolded for not being team players, and now it sounds like, and I need to get up to speed on what the health minister said last night, but it sounds like there are signals that there are efforts made to fast track international healthcare workers, for instance, and you labor unions are reluctant to give any credit at all for that. So
No,
it sounds like the two sides are so entrenched that you can't agree on anything.
Well, he's definitely entrenched in removing Bill 124, but nobody is criticizing that option. But again, people coming out of colleges are coming into the environment and the working conditions, and they aren't lasting. The 3 weeks and they're out of there. So we need just, a better solution than just to keep bringing people into a collapsing system that is literally tearing down the workers. And even if they're internationally trained, when they come in, the environment and the working conditions have to be improved before they're going to stay. We've proven that. We have an exodus like we've never seen in the province right now.
Ross, I think we're saying that you can't rely on the colleges to solve this problem, that the number of people they can credential is relatively small compared to the total number of vacancies. With respect to incentive, you've got to give it to a province like Newfoundland for at least coming up with a plan. And that's kind of where we would like to be, is having the discussion with the Ontario government about what a plan looks like. But I would say on the question of incentives, first, the Ontario government increased wages for personal support workers, which was long overdue. But they did that with a $3 an hour increase in long-term care and $2 in the hospitals. Then, because that begged the question, well, what about the contribution of nurses? They came up with a one-time lump sum payment. And you don't have to be too smart to figure out that $4,000 a year for the rest of your life, because the government has promised to make the PSW adjustment permanent, is worth a lot more than $5,000 in a one-time payment. This is the kind of erratic approach to labor relations which demoralizes people because they feel their value is not recognized. And so, we'd like to have that discussion as well with the government.
And Ross, I'd like to add to your question. It's not that no one disagrees, but you need to sit down at a table and have a wholesome discussion, because I support bringing in the international trained nurses because we need more bodies in addition to everything else. But you can't expect a nurse to show up on day one and understand how the Ontario system works. That's why we need mentors. They need to learn what the assessments are done in the hospital, what the policies are, what advanced directives they have that they work under, how the system works with reaching out to docs for orders, all those things like that. They can't hit the pavement to work unless they have mentoring, and mentoring as a registered nurse that, you know, works in an acute care hospital has very few doctors available because they're spread so thin all over the hospital. That is an unreal expectation. So it's not that we don't agree, but we have to have a plan that's going to support them, or out the door they go.
Okay, thank you all very much.
Thank you, Russ. Yeah. Andrea, you're next.
Yes, can you hear me? My question is, first of all, I just wanted to ask, you mentioned more or less 20,000 vacancies in hospitals, but you think it's double that number. Is it only for nurses or for just all kinds of staff in hospitals?
That's for all staff.
Okay, and I had a follow-up question. Can anyone answer a question in French by any chance? I'm with CBC French.
No, sorry.
No.
Regrettably, no.
It's okay. My other questions have been answered already.
Merci.
Merci.
Our apologies. Thank you, Andrea. Amar, sorry.
I know. Good morning, it's Amar. Yeah, so one of the questions I had was the premier came out on Wednesday, I believe, and said that people were being seen in a reasonable time. And I know the ONA had put out on Tuesday saying that, you know, at least 25 hospitals were turning people away or didn't have the capacity to see more patients. Can you just speak a little bit to him making that claim? And also if that is, you know, effectively saying that either the ONA isn't getting it right, and that he has the right statistics. I'm really curious to understand how you took this comment.
So I can speak to that. So the stats he was using, I believe, were April or May stats. And I myself was in a hospital last week where the sign out was 9 to 10 hour wait, that they were letting the patients know, which, you know, really means more than that. So the wait times have definitely increased. Also, I believe he gave the number that 24% of people are admitted from the hospital visits. I'm not sure what he meant by that, because if you have a hospital that does 400 visits a day, which is not unrealistic whatsoever, then that would mean we're admitting, you know, around 100 people a day. And so those are large numbers, which would explain why people are in chairs, hallways, offices, storage rooms, things like that. So those numbers were not real-time data. And as far as bed closures and that, I have my nurses texting me, emailing me every single day with all the closures. And you would be shocked if you really knew the silent closures.
Yeah, I would say when I heard that, I took it as a celebration of failure. I would not want to be one of those 10% that don't get the service in the province of Ontario.
Sorry, I'm still here. My follow-up is the premier also didn't really lay out any immediate plans of what he would do, how he would counteract, you know, the shortage right now. Foreign trained nurses is something that realistically, you know, the first time I wrote about this was March 30th, 2020. So it could have happened 2.5 years ago. This has been very slow to the push, especially when, you know, we've had people like the Army come in. This shortage has been long predicted by healthcare experts. Why has this step taken so long to get to this point where hospital systems are essentially, you know, bursting at the seams, and now we're finally getting to a point where these people are finally getting the, you know, being brought into the system like they should have been?
I think now when you have hospitals actually putting out alerts in their community, the situation is so dire, and that is finally bringing attention to the public that needs to, that they should have been made aware of a long time ago. But, you know, with anything, you need to use your experts. I mean, they're they're the government and they have the funds and they can push legislation through, but we're only here, we want to help them. We don't have a hidden agenda, to be brutally honest. We really don't. We want healthcare to work. We want the people of Ontario to have their healthcare. And that's all, that's honestly all we're looking for. And that means staff at the end of the day. And I find it really troublesome why it's such an issue to sit down with us, because when we sat down together on Directive 5 and came out with the PPE, we did that over a weekend and it worked. It's just called working together. That's all we're asking for. It honestly is.
Sorry, and just really quickly, as a follow-up to that, I know, is Bill 124 seen as all three unions here the most clear-cut solution, quick term to what we're experiencing with nurses shortage and also healthcare shortages? And is there something else? What are those quick steps that we can be looking at immediately? Sorry, that's it for me.
Bill 124, go ahead.
No, go ahead, please, Michael.
Bill 124 kind of goes to the heart of the demoralization that the existing workers feel, which is, although the public and the government say that they've made a tremendous contribution, which they have, the reality is that their wages are being cut significantly in real terms. And that is an expression, that is not an expression of their value. And, people are leaving for better work or just because they won't do it anymore. So with respect to retaining people, the government making a statement, making a move on the wages and the other conditions of work, like being able to bargain mental health supports, et cetera. These things are very important, but they're only one part of a multi-pronged approach, which is what we're saying. So opening up post-secondary spots, bringing back the people who've retired, offering incentives, these are all elements of that plan. But if the government wants to speak to to retention and to the problem it has with demoralization of the existing workforce, it has to address Bill 124, I would say.
Yes, and they should do that immediately. And I said, I have a pen right here in my hand if he needs it. It can be done this afternoon. It is the most demoralizing, it is the most undemocratic, it is the most sexist piece of legislation that I've ever seen in my career. And why he doesn't want to start with that is beyond me. I don't know. Yet they'll pay 4 times hourly rates for agency staff. They'll recruit outside the country. He won't deal with his own people in his own province. All it takes is a signature that he can do this afternoon.
Adam, you're next. Adam Donaldson.
Thank you. I guess let's play hypothetical and say that, the Premier gives into your 5 demands this afternoon. How quickly can the boat be turned around then, given the directions you've laid out? I mean, would we see immediate change like next weekend?
I really believe, again, that if he signaled to those frontline workers that he sees them, he hears them, he feels them, repeals Bill 124, agrees to meet with his unions who speak for 120,000 of them, and start to demonstrate some real movement on solutions that can start today. There's many of them that won't be in the near future, but they need to see something come out of his office instead of your heroes. These are human beings who are literally collapsing in front of our eyes. If they're not collapsing, they refuse to be working and jeopardizing any patient in the province because of their exhaustion. So some of it is immediate, he could do today. Some of it is show that you're meeting with the unions and recognizing the 120,000 that we represent.
There's no one fix, but we all know, in our own lives, if things aren't going that great and that wonderful and, it really gets you down, and then something happens that gives you that bit of hope, and that would be it. Because of course, it's not going to be taken care of by this weekend. We have to sit down with the OHA, renegotiate, things like that. But if the Premier were to pull and repeal Bill 124, it will be a ray of hope that nurses can say, okay, the government is going to back us. They're finally going to help us out. And that's what they need. It's honestly what they need. But that's only a start.
And I'll just say it again, Adam, either the government has a plan that works or a plan that's failing, and their plan is failing. There's all kinds of stats and evidence of that. So let's start working on a plan that works.
I think the people of Ontario and certainly the hospital workforce are looking for the government to articulate a plan that gives people hope that this situation will be turned around, that their community hospital will be open fully, that it'll be staffed up, that we can run the services we need to. And I think if we can just get to the point where we can send them that message, you'll see the retention problem start to get corrected. And as we incentivize people, that will turn around. How long that will take, we have to work on all that. But the first thing we need here is leadership.
Thank you. And my follow-up is directed to Cathryn. You've talked a lot in this media availability about silent closures. Would it be possible for you to make those not so silent and talk about some examples of closures that aren't getting mentioned that you can talk about?
It's really sad because a lot of my nurses are afraid of termination if they speak out, but I can speak about, I thought I had a list here real hand. Well, I have lists of them I've sent to our communications department. So maybe you can reach out to them, but there are labor and delivery. That is a huge, huge problem, that they're closing the beds or they only have 2 staff on and, 3, 4 laboring moms. You cannot do that. There are procedure units that don't have enough staff. So you're having a nurse jump from the head of the table to the end of the table. That doesn't work. Cardiac beds are closed. Emerges may not be closed, but they decrease that. A hospital that I talked to this morning, a nurse, 3 critical care patients for 1 nurse. And that's definitely wrong. They can't meet the chemotherapy. There isn't enough nurses, so they're having to delay that. Medicine surgery beds, Oshawa, Lake Ridge, we all heard in the news about their closure of their Bowmanville site. And I understand from nurses reporting to me that there's major bed closures throughout the Oshawa site. It's just everywhere. No one is untouched. But I just want to take a moment and also remind you that we have home care out there that is very much suffering. And we have people that need nurses in the community, that there's no nurses to send into the community. Public health, we're seeing more people in emerges because public health is dry too of nursing. It doesn't, no area is unaffected, and every area of nursing ties with one another because home care keeps people out of hospital or gets them home earlier. Public health keeps people safe so they're not coming to hospital or they don't need home care. So it really is a vicious circle that we have to look at all aspects of it when we're looking to correct this tidal wave of a disaster of healthcare that we have.
Thank you.
Are there any other media who have questions? Well, I'm just saying, I'm very grateful for you attending this media conference. Over to you, Cathryn and Sharleen.
Yeah, I just want to say too, thank you very much for your time. It is a crisis that affects each and every one of us. Hopefully we will have our meeting with the Premier, that he'll listen and take note of the 120,000 voices that we represent. Take a look at our 5-point plan. The media release link, I think, was in the chat. It'll be there shortly if you need it. Anyway, thank you all so much for attending.
And thank you very much for taking the time to listen to us. And truly, we speak for our members, but more importantly, for the people of Ontario.
Thank you.
Thank you very much.
Record